Yeah.
Someone was asking, talking about any woman. So I was like, wait, and the dads, because you see, and especially if it's like the first time,
Yeah.
like the first child, they don't know what's happening.
Yeah.
They don't understand. First of all, why is this child not sleeping when everybody else is supposed to sleep?
Yeah.
Why is the mother cranky? Why is the mother moody? So someone was asking, do men go through the same? Like
Postpartum depression,
some
no?
form of some form of like okay, not necessarily postpartum. I don't know what name they were calling it, but yeah.
Maybe I would say something called, and I would say this very lightly because
Okay.
for all psychological mental illnesses, we have to diagnose
Yeah.
so that you understand what it
Yeah,
is.
what exactly it is, yeah.
They may go through something to do with anxiety, so possibly generalized
Anxiety, okay.
disorder.
Yeah.
But postpartum depression, no, because they did not carry the baby.
They did not. Someone was saying, you know how some men, and especially after childbirth, right?
Yeah.
They would not come to their house.
Yeah.
They would actually fake like us. We have a meeting and it's
Yeah.
going to take like 3 months outside the country,
Yeah.
so they would go,
Yeah.
so that they're not in the house for the first 3 months when the baby
Yeah.
is born, because then they're going through like mental torture because the baby is crying all the time. The
Yeah.
mother is moody. There's milk. You have to, like it's a lot. So they're like, yeah,
Yeah.
that's postpartum depression for men. So us, we have to go. No, men
No,
don't. No,
it's
they
not
go through
possible.
anxiety.
Yeah,
It's not
just
possible.
anxiety,
Yeah.
yeah.
Okay then. So as far as then diagnosis is concerned, so we said 3 months in, and then it could last for a year.
Yeah.
Again, are there like factors that probably determine? One goes through it for like a month and then they're okay, and the other one goes for a year and still have to deal with the same. Do we know why, or it's different for different people?
Treatment and
okay.
intervention.
All right.
So the longer mom prolongs to get treatment, the longer the condition prolongs,
Yeah.
because you haven't done any intervention to
Okay.
it. So it will stay there. Again, you cannot wish away
It away, yeah.
a mental condition.
Yeah. Okay. And before we get to that point, where we talk about treatment, diagnosis, and all those things. Now,
Yeah.
so first-time moms, right? Like you
Yeah.
said, this is new. They do not understand what's going on.
Yeah.
So for them, yeah, we can understand they might get or go through postpartum depression. But what about someone who has had kids before?
Yeah.
Okay. Not can they? Do they also go through phases of postpartum depression?
Actually, it can reoccur.
If you've had it before?
Yes.
Suppose if you've never had it before.
You don't have a unit measure. You don't have
Yeah.
a reference.
Yeah.
For previously. But it's no surprise that we have seen women who've had
Yeah.
a first child with postpartum depression and a
Yeah.
second child with postpartum
depression. Okay.
It does reoccur, but it also may not
Might
happen.
not. Yeah.
Yeah. So
Okay.
it doesn't sit. It's not a straight line.
Yeah.
It's not a give
You
and
got
take.
this? Yeah.
There are a lot of
you eventually
gray
get
area.
it. Yeah.
Yeah.
Okay. But it's possible that, let's say, if you have like 3 children, probably you did not go through postpartum depression with the first child, and then with the second child, they might get it with the third child, or even fourth.
Yeah.
Like if you've had children before and you did not experience them, you can still experience postpartum depression with this other child.
Yeah.
Okay.
Let me just highlight something.
Yeah.
Apart from what we detailed before, which
Yeah.
is the mood disorders, anxiety disorders,
Yeah.
depression, bipolar, all that stuff, a mother may not have those things, but her delivery time or when she's
Yeah.
giving birth
Yeah.
is so traumatic, it could lead to postpartum depression.
Okay.
Prolonged labor,
Yeah.
possibly just when you're giving birth, just that pain is unbearable to you.
Yeah.
A childbirth in and on its own is quite traumatic because it's not something that you do every other day,
yeah.
and then it's a process. So that could also be a factor that may lead to postpartum depression.
Okay.
And ideally, you can find that mom has baby 1, easy delivery. Baby 2, easy delivery.
Yeah.
Baby 3, difficult delivery.
Yes.
Because as you've said, the older you grow,
Yeah.
the harder it is to get pregnant,
Yeah.
to even sustain a pregnancy.
True.
And that could also be perceived as a traumatic birthing experience.
Yeah. So it could lead to the same
Could.
postpartum, but it's not like definite.
No,
Because
it's
there's
not.
probably someone who's pregnant and probably having like a difficult
Please
pregnancy,
don't
be like,
fear. Don't fear.
Could it? Could it not? Okay, then. So diagnosis. What are you looking at, and how long does it take to diagnose someone with postpartum depression?
So the person has to go to, of course, a doctor,
Yeah.
or a psychologist, a certified psychologist,
Yeah.
or someone who is very well grounded in the medical field.
Okay.
Yeah. Then what will happen is that the doctor will talk you through how have you been feeling.
Yeah.
So they will observe your emotions, your thoughts, and your behavior.
All right.
You will take something called a depression inventory. We normally use different tools. The most known is the Beck's inventory tool, where you ask a bunch of questions and you tick out. And the number that is collected there gives the classification. Is it mild? Is it moderate?
Or
is it
severe?
severe?
Okay.
So the doctor will take you through that whole diagnosis. Now, if the depression is too much, or if it's on the severe side, the doctor or the psychiatrist, actually on this point, it's a psychiatrist,
yeah.
they will give you a prescription on antidepressants or mood stabilizers. Some antidepressants are safe to take while you're breastfeeding, and this is something that the psychiatrist will
have to prescribe now.
Yes, yes,
Okay.
they will keep in mind.
All right.
So that's how the diagnostics and the somewhat medical intervention would look like.
Okay.
Yeah. If it's psychotic, the person has to go into a psychiatric ward.
Yeah.
Because remember, psychosis is losing touch of reality. So, and during the psychiatric intervention, they are given medication for mood stabilizers, antidepressants, sleeping medication, just to get back the person into, at least into a functional human being.
Yeah.
Now, if those fail, we have the medical personnel can prescribe ECT, electroconversion therapy.
Okay.
So what happens in ECT, actually, it's the last resort on any mental condition.
All right.
Or when a person goes into a catatonic state. A catatonic state is when one person sits at one position for a prolonged duration of time. And they don't get tired.
Yeah.
And they just sit in one position. So what happens in ECT is that they place nodes around your head, and they administer a very small current to just kickstart the brain.
Yeah.
Research has shown that the ECT, the current, is able to reverse mental damage on the brain.
Okay.
But as to how that happens, it's not really known.
Yeah, I was about to ask how.
But remember, this is the last resort.
Yeah.
And it's administered by a medical doctor and a local anesthesia. So the ECT normally takes 30 minutes, but it's given in durations as prescribed by the psychiatrist.
All right. It's not like a one-time thing and then back to reset.
No.
Okay, has to take a bit of time.
Yeah.
Now, okay, so for those, how bad can it get? Because one might ask, and especially when they get to that phase where they're psychotic, okay?
Yeah.
Like, how bad can it, how bad can it get? Like, what can they do to themselves, to the family, to the child, you know? How bad can it get?
So let's look at the positive, that it's very rare.
Yeah.
It's one in
Thank
one
God.
or two in
Yeah.
every 1,000 women.
Women, yeah.
How bad can it get? It's psychosis. You are not in touch with reality.
Yeah.
So what you perceive as true is not true.
It's not true.
Yeah. To the point where what you're thinking rationally is actually not true.
Yeah.
So it's really, really bad. It's like saying Winnie is not here, but Winnie is here.
Yeah.
You get it?
Yeah.
So it's bad to put it.
Yeah.
Psychosis is not a light matter. In terms of the behavior, harming self, mom would want to harm herself, and she'd also want to harm her baby. In some cases, she'd want to harm everyone around her.
In the house, yeah.
Yeah, because remember, she's not in a normal mental state.
Yeah.
So what she's doing makes sense in her mind.
Yeah.
And that is psychosis,
Yeah.
because it doesn't make sense to anyone else around you. And even the behavior that exhibited is completely on the extreme. It just does not make any logical sense.
Yeah. But to them, it makes total sense.
Yeah, because the lady I was telling you about, she was saying, can you not see these people around me? They're here to kill me. And there's no one around them. But for her, it's it's real, it's true. So the first thing that they do, or if mom gets there, is she has to be administered into for psychiatric help.
Yeah, because they may end
Purely
up harming the
psychiatric
baby.
help.
Yeah, because I've also had people say, and especially since, again, we do not really understand this, that one time, like, but she was okay, you know, she was fine, she was taking care of the baby. And then the other time, she's like beating up this baby, and some was actually saying they were cutting up the baby. Some was even throwing the baby on the floor. And people are like, Kwani, what is wrong with you? You know,
see,
try to punish them. But really,
in her mind,
yeah,
the cause of the turmoil within her is the baby's fault.
yes.
So the baby becomes an object of her wrath, if you would say. And that doesn't make sense.
No.
Because the baby is helpless, they need help, they need love.
They're dependent,
They're
literally,
dependent,
on you. Okay then, so fine. So ECT said last resort, right? So for those people with like mild symptoms of the same, what happens? Do they go through just therapy on its own and then get back to life, or something has to be done?
So again, we start with diagnosis.
Yeah.
The level of depression is ascertained. If it's mild or moderate, the psychiatry can either say, if it's mild, we'll administer this amount of dosage on antidepressants and mood stabilizers. But both of them can be cured or managed through talk therapy.
Oh, okay.
Which is normal counseling sessions. Because in therapy, in talk therapy, we look at what are you feeling, what are you thinking, and because of those thoughts, how are you feeling, and why are you thinking that?
Okay.
So ideally, we just deal with the thoughts and try and help mom understand and see. We actually take her through the whole journey of her pregnancy.
Okay. Oh yeah, get to understand
just the background of it.
Of the pregnancy, and then,
so that she can see first, it's not her fault.
Yeah.
And also so that she can now perceive that there is hope. And the reason why the Lord made us talking beings is because talk helps. So talk therapy also helps.
Okay. So that is more on the mild symptoms,
moderate,
mild and moderate symptoms as well. So do they? Okay, prognosis for the same. Are they expected to get better, and especially for those ones with like mild and moderate? Is there a specific timeline that they're supposed to get better? And then if they don't, then it means probably it's more serious than what you know?
It is.
Yeah.
It depends with if she has a comorbid mental condition. So comorbidities.
Yeah.
Does she have two mental conditions recurring? So does she have depression and anxiety? Does she have an underlying personality disorder? So it depends with that, because for personality disorder, therapy is long-term.
Long-term,
Because you're dealing with a personality. You're not dealing with mood or thoughts per se. But if the depression has been caused during and after delivery, I would wisely say, and this doesn't apply across.
It's not cast on stone.
It's not cast on stone. Between 8 to 12 weeks.
8 to 12 weeks.
Yeah,
okay.
She should be okay.
All right. But again, like you said, it's not like after 12 weeks, if you're not okay. No. Plus, again, we're different. You know, people are different. So really, it depends. Okay, then. And then for the ones with like severe, there's no timeline for that. Is there?
So for severe, remember the person is taking medication. And talk therapy is coupled with pharmacology or medication. So as long as the person is on medication, they are on
talk therapy as well.
Talk therapy as well.
Okay.
So such sessions are normally engineered by the psychiatry.
All right.
Because the person who's on medication always has to go back after every 1 month, between 3 and 4 weeks, to check this. So the psychiatrist will check how you're doing, how you're sleeping, how is your mood, and if they're getting better, they will lower the mg or the power of the medication, and then we finish off with talk therapy.
Okay. Okay. Depends. Now, you talked about an aspect, especially those who get into that aspect of psychosis, then they have to be admitted to psychiatric ward for how long? Oh, again, it differs.
It depends.
Okay.
And I don't think I would be the right person to even tell, because I'm not a psychiatrist.
Yeah.
So the psychiatrist would be
would tell.
Would tell, yeah.
Okay.
But the cases that I have read and listened to, again, this was in the States.
Yeah.
They were not there for more than 2 weeks.
2 weeks.
Yeah.
Okay.
Yeah.
So at this time, are they allowed to somewhat like see the baby, or like the baby could come visit for like? No.
No. When you're in a psychiatric ward, no.
No.
Yeah.
Doesn't that make it? Oh yeah. Okay, makes sense, because I'm thinking, if you were thinking that the baby is the cause of your problems, then it wouldn't make sense to have the baby come see you, because again, it would either trigger like more reaction from the same, or make the condition worse.
And
so,
also remember, the medication they're taking is quite strong.
It's quite strong, yeah.
So mood stabilizers, they possibly will be asleep for a long time.
Okay.